What is a home care package? And how does an aged care provider manage these?
So they're generally, broadly speaking, there are two types of care delivered in the aged care space. One is for people who enter an aged care facility, an aged care home as they're sometimes called. So you move in, right? That's where you live now. And that's where you also receive nursing care and personal care and so on. However, the other, broadly speaking, type of care is at-home care. So rather than moving into an aged care facility, you stay at home. And that's something that the federal government is really keen to do to keep people in their homes for longer. We know that there are better outcomes, generally speaking, for people. If they don't need full-time care, then they're able to live in their own home, in their own surroundings, nearby friends and family and so on. So at-home care is when the care comes to you. And that is done by way of an aged care or service provider, sometimes called a community care provider. And in that instance, you as the recipient of the care or support apply for a funding package. So you get a certain chunk of money from the government, which is to be used for a defined set of services. There's a budget associated with it and so on. And so, for the year, you might have $200,000 to spend on some nursing care, some home care, some gardening, some cleaning, and so on. And the objective there is that you have to manage that spend so you don't run out of money in your aged care package while you still want to be receiving the services that go with it.
Yeah, so it's not something that all aged care providers offer. No. It's only a fraction of them.
Yeah, that's true. Interestingly, historically or traditionally, when we think of aged care, we have thought of nursing homes, right? Aged care facilities, as we like to call them these days. But increasingly, aged care providers, and some of these businesses have been around for 50, 80, 100 years, the aged care providers are increasingly having to look at home care as part of their business model because there aren't as many people moving into residential aged care facilities, but also because there's a whole kind of customer journey, a life cycle thing there, where somebody might start off getting home care and eventually move into an aged care facility.
Interesting.